Alright class, welcome to dental board exams. This is dental anatomy review lecture number 3. So I hope that you have reviewed the previous classes, and also these videos are available for your review. Make sure you go back and review this material. So today we're going to discuss dental anatomy. So we're going to start talking about the specific teeth anatomies. Okay, so make sure you pay attention, because everything which is discussed here is very high here, the things that you're supposed to know. So here we're going to discuss the mesial and distal surfaces of anterior teeth. Okay, so we're going to discuss anterior teeth first. From there we're going to go to posterior teeth. Okay, all right. So the anterior teeth, when you look into the proximal view, the crown of the anterior teeth exhibits a triangular shape. Okay, as you can see in the picture, and the base of the triangle is at the cervical. Okay, and the apex of the triangle is at the incisor. Now remember, in the last lecture, when you view the teeth in the lateral view, they form a trapezoidal, and the base of the trapezoid is at the incisor. Okay, so this is different when you view the teeth, the anterior teeth, in the proximal view. Okay, they form a triangle, and the base of the triangle is at the cervical, and the apex of the triangle is at the incisor. Keep that in mind. Okay, so this shape, this triangular shape, fits into the function of the anterior teeth, which is incising food. Okay, they work as a wedge in tearing, biting, and also, as I mentioned, incising the food. All right, so review this slide. Make sure you know the basics anatomy and the shapes that the teeth form. All right, so when you look into the when viewed in the labial view, okay, of the anterior teeth, as depicted in the pictures here, the mesial surface of the crown is straighter when you compare to the distal surface. Okay, the distal surfaces usually are more rounded or curved. All right, so you have to keep those in mind as you go through these lectures, that medial surfaces of the anterior teeth usually appear straight when you compare to the distal surfaces. Okay, so distal surface appear round. Now remember, distal, okay, the letter D has more curves, okay, compared to the mesial, compared to letter M. So D for more curvature, well rounded. Okay, so you can always remember distal is more rounded than the mesial. Okay, all right. So again, on the anterior teeth here, so in the labial view, we're still on the labial view of the anterior teeth. Okay, the mesial incisor line angle is more square. So remember, because the mesial surfaces is straighter than the distal surface, so when the mesial surface and the incisor surface meet, they're going to form more of a square. Okay, almost like a 90-degree. Okay, so the mesial incisor line angle is more square in the labial view of anterior teeth, and the distal line angle is more rounded. So remember, distal is rounded. Okay, all right. Now the maxillary central incisor. Okay, so the maxillary central, as remember from the last lecture, when we were looking at according to the curve of Spee. Okay, according to the curve of Spee, the maxillary central incisors are the most axially inclined teeth in the mouth, okay, because they are labially inclined, okay, remember that, okay. And we also saw that according to the curve of Wilson, the crowns, okay, of the posterior teeth in the mandible, they lean lingually and the roots to the distal, and in the maxilla, the crowns lean to the buccal and the roots lean lingually. Okay, keep that in mind. And the most, so we're reviewing here, and the most upright teeth in the mouth, according to the curve of Spee, is the premolars. Okay, now maxillary central incisor. Okay, the crown of maxillary central incisor is the widest. Okay, it is the widest measured distally of any anterior teeth, including the canines. So, of any anterior teeth, which tooth is wider, mesial distal? It's the maxillary central incisor. Okay. So high-heeled stuff that you're supposed to know. Okay. All right. I know I mentioned okay a lot, but that's just to make sure that you understand and keep paying attention to these lectures. Okay, so mamelons. We discussed last time that all anterior teeth develop from 4 lobes. Okay, they have 4 lobes and 3 mamelons because the 4th lobe is usually the cingulum. So it doesn't form, the cingulum doesn't form, is not part of a mamelon. So mamelons are sometimes found on the incisor edge of newly erupted teeth, okay, and have been referred to as evidence of 3 labial lobes, okay. Remember, there are 3 labial lobes and 1 lingual lobe, which forms the lingual lobe forms the cingulum. By the mamelons, when those lobes come together, they form depressions, okay, or developmental depressions, which appear like mamelons. Now, mamelons are not only found in newly erupted teeth. If you want to know that somebody has malocclusion, if an adult has mamelons on the teeth, it means that adult patient has malocclusion, because it means that the incisor teeth are not occluding. Okay, so that's the significance of mamelons. If you see somebody who has mamelons and is an adult, just know that there's some kind of malocclusion. Okay. Now, you look at the picture there, so you can see that there are 3 mamelons separated by labial developmental depressions. Okay. And the maxillary central incisor also shows imbrication lines. You can find imbrication lines in the cervical portion. So in imbrication lines are horizontal lines on the cervical surface of the maxillary central incisor. Okay. So the most common number of mamelons is 3. Side note is that due to the rounding of the distal incisor angle, the most common number of mamelons on the maxillary lateral incisor is 2. All right. Remember, the distal portion of maxillary lateral incisor is you say 2 rounded when you compare to the centrals. So because it's 2 rounded, where you are going to see when we discuss the lateral, the 3rd mamelon, okay, the distal labium mamelon is not there, so you only have 2 mamelons. Okay, that's a very good board question that you have to pay attention to. All right. Now the labial developmental depressions So further, there are further evidence of separation of the labial lobes of the anterior teeth. Okay, and the developmental depressions they are usually shallow depressions which are found in the incisor portion of the labial surface, therefore causing mammelons. Okay, and the linear developmental depressions, uh, vertical depressions, they are named according to the position. So you have the mesial, distal, okay, and middle labial depressions. But the middle labial is not there, so you only have the mesial and distal labial developmental depressions. Okay. All right. Still on the maxillary central incisor. So the maxillary central incisor, when you look at it in the incisor view, okay, the crown has a triangular shape. So when you look at a maxillary central incisor in the proximal view, it's triangular shape, okay, and the shape of the triangle in the proximal view, the base is at the cervical and the apex is at the incisor. When you look in the incisor view, the base of the triangle is at the labia, okay, and the apex of the triangle is at the cingulum. All right. The crowns of all anterior teeth are triangular or wedge shaped in the proximal view, as we saw earlier. Okay. So this is a mesial view of the maxillary central incisor. So when viewing in maxillary central incisor from the mesial, you can see that the incisor ridge of the crown, okay, is normally in line with the center of the root. Okay. The incisor ridge of the crown in the maxillary central incisor is in line. So if you draw a line from the incisor through the root, it's going to be directly in the midline. Okay, so the apex is going to be in line with the incisor ridge. Okay, very important point to remember here. So sometimes maxillary central incisors can have extra teeth. Okay, if there's an extra tooth between the tooth number 8 and number 9, then you call them mesiodens. Okay, mesiodens are extra or supernumerary teeth. Okay, that may be found between the roots of maxillary central incisors. Sometimes you have extra like enamel or cusp on maxillary centrals. As you can see where the blue arrow is pointing, that's an extra cusp, okay? Almost like developing from the cingulum. That's called a talon cusp, okay? It's a large accessory cusp found on the lingual surface of the crown, okay? So make sure you know what a mesioden is, where they're most likely to be found, what a talon cusp is, and where they're most likely to be found. Okay, so another one of the favorites is the maxillary lateral incisor. Okay, so the maxillary lateral incisor has more variation, okay, than any other tooth except the third molars. So the third molars have more variation of any other tooth in the mouth. The second tooth to be more variant is the maxillary lateral incisor. And because it has more, the maxillary lateral incisor has more variation. Sometimes it forms what we call peg laterals. Okay, a peg lateral is looks like almost like a talon tooth, like a talon cusp, but just on the maxillary lateral incisor. It's a very small, narrow crown. Okay. Um, so some of the variation of the maxillary lateral incisor, you can have a peg lateral. You can have also a palatal gingival groove. Okay. Another good question that most people like to be asked is that there is always most of the time there's a palatal gingival groove, and the clinical significance of this is that if you have a palatal gingival groove, the patient first of all won't be able to brush in that area, and sometimes the food gets stuck in there, so it causes cavity, and so also when you're doing a cleaning, it's very difficult to clean in that area. So this groove extends from the from the cingulum area onto, sometimes it extends onto the root. Okay, and sometimes you find a lingual pit on the maxillary lateral incisor and dense indente. This is where the lingual pit invaginates, becomes bigger, but the dense indente is when the invagination also has enamel in it. Okay, it has enamel, so it's like a crown within a crown. That's what they call dens indente. Is translates into a tooth within a tooth. Okay, so that's a critical point, and so caries often are associated with the lingual pit and dens indente. So the clinical significance, which makes it difficult to treat. The largest incisor embrasure, okay, the largest incisor embrasure exists between maxillary lateral and the canine. Okay, remember that. Where is the largest incisor embrasure found? It is found between maxillary lateral incisor and maxillary canine. And that is because, remember, the distal surface or the distal line angle of maxillary laterals is more rounded. Okay, so that leaves more opening or a wider embrasure between the canine and the lateral incisor in the maxilla. So still on the maxillary lateral incisor, as you can see, this is the lingual view of the maxillary lateral incisor. Okay, the marginal ridges on the maxillary lateral incisors are usually more distinct, okay, of any other incisor. So how I see this is that it looks like almost like a spoon. You know, when you have a spoon and you want to drink some soup with it, you want a nice spoon with well round with almost rounded edges, so that the soup won't get lost. That's that's the same with the lateral incisor on the lingual surface. It's like you have a depression. Okay, you have a lingual depression, and then you have the lateral surfaces. Okay, the edges well rounded, so it's more prominent. Okay, more distinct. Remember that, very key points here. And the lingual fossa is the most distinct of any incisor. Okay. Another point is that the crown of the lateral incisor lingual surface has been described as markedly concave. As I mentioned, it looks like a spoon, so it looks like concave. All right. It is the anterior tooth most likely to have a lingual pit. So what is the anterior tooth that is most likely to have a lingual pit? It is the maxillary lateral incisor. What is the anterior tooth most likely to have a palatal gingival groove? Maxillary lateral incisor. What is the anterior tooth? Most likely to have a peg, uh, a peg-shaped tooth. It's maxillary lateral incisor. What is the anterior tooth? Most likely to have dens indented. Maxillary lateral incisor. Okay, so keep that in mind. Okay, so now what the green arrow is, okay? The mesial, that's the mesial surface of the crown. All right, this is the lingual view, remember? So the mesial contact area of the maxillary lateral incisor is located at the junction of the incisor and middle third. Now, here's a trick, okay? Remember the contact areas according to the curve of speed. That's why you have to review the videos the way they are presented. Okay, you have to see review 1, 2, and 3. So you cannot review 3 and then go back to 1. Okay, you have to go in order because everything adds up. Okay, remember we said according to the curve of speed. Okay, you have the contact areas which progress from the anterior, from the incisor aspect to mid cervical as you progress from the anterior to posterior. So it means the mesial contact areas of any tooth is usually a little bit higher than the distal contact area. That's a rule according to the curve of speed. So if here in the green box here, if it says the mesial contact area of the maxillary lateral incisor is found at the junction of the incisor and middle thirds, it means that the distal contact area is going to be a little bit lower. Okay? And look at the yellow box here, what it says. The distal contact area is located in the middle third. Okay, so the mesial contact area, and you look at the arrows of the green arrow and the black arrow. Of course, these are maxillary incisors, so it's on the top. So the mesial contact area is more coronal, and the distal contact area is more apical. Okay, so mesial contact, remember to memorize. You don't really have to memorize everything, just have to know the principles, okay, of the contact areas. But it's very important for your exam, okay. So mesial contact area of the lateral maxillary lateral incisor is in the junction of incisor and middle third, and the distal is going to be at the middle third, okay. And the tooth, okay, meaning the lateral incisor, frequently has an abnormal relationship and contact with adjacent teeth in the same arch. Which tooth which tooth mostly has an abnormal relationship in the mouth with other teeth? It's a maxillary lateral incisor, okay? All right. So here the lingual view of maxillary lateral incisor. So you can see that it is narrower mesial to distal than the maxillary central. Also in the lingual view, there is a flat mesial surface, which is straighter, and the curved distal surface. Okay, so that there's principles that we saw earlier. Okay. Now, look at where the arrow is pointing. The incisor edge, okay, so that's the red box. The incisor edge is the most rounded of the permanent incisors. So most incisor edges, they're kind of straight, horizontal, or when you come to the canine, the incisor edge is going to be pointing. But when you come to the lateral, maxillary lateral incisors, the incisor edge is almost rounded. Okay, keep that in mind. And the lingual fossa of the maxillary lateral incisor is most distinct, as we mentioned before, with more distinct or prominent marginal ridges. Okay, all right. So, coming to the mandibular teeth, the mandibular central incisor is the smallest permanent tooth in the mouth. Oh, try to do endo on this teeth. It's terrible. Okay, because sometimes they have like two canals, all right, which is very small. So perforations are very likely. Okay, but they are the smallest teeth in the mouth. Okay, and the incisor view, the cingulum is centered. Okay, maxillary central incisor, the cingulum is centered in the incisor view. And the mesial and the distal contact areas are at the same level in the incisor third. Now remember, when I say according to the curve of Spee, the mesial contact area is usually more coronal compared to the distal contact area. Now, because these the mandibular central incisors, tooth number 24 and 25, because they are straight, they contact in the same area, okay, which is the incisor, okay. So the mesial and distal contact areas of tooth number 24 and 25, they are in the incisor third. Remember that. The mandibular central incisor has the most symmetrical crown in the mouth. It is difficult to distinguish between the mesial and the distal portions. So usually, if you're going to identify which one is right, which one is left, meaning which one is number 24, which one is number 25, you have to look at the the extracted root. The root, okay, is going to deviate to the root apex, deviates to the distal, okay. So you're going to know, oh, okay, this is the distal side, and you can determine whether it's a left or right, okay. So a lot of questions on maxillary lateral incisors, okay. All right. So the crown of mandibular lateral incisors, okay, appears to be twisted. Okay, let's say that again. The crown of the mandibular lateral incisor appears to be twisted on the root. Okay, as you can see, look at the green line there. Look, it's slanted. Looks like the crown is twisted. Okay, in relationship to the root or the cingulum. All right. The incisor surface angles lingually as it progresses distally. Oh, I love this one. I love this sentence. Angles lingually as it progresses distally. Okay? So you have to keep this in mind. Okay? Very colorful. This is a very colorful PowerPoint to help you memorize. Okay? So that when you're in the exam, you can say, oh, yeah, I remember that picture with a twisted tooth with a green line, okay? Because the incisor angle, the incisor surface angles lingually as it progresses distally. So as you can see, the distal surface, or almost the distal aspect, is almost like a leaning to the distal and to the lingual, okay? And the cingulum of the mandibular lateral incisor bulks to the distal. Okay, the cingulum bulks to the distal. All right. So this is the lateral incisor. Um, as you can see now, the aspects of this is the proximal view. Okay, very important. This is the proximal view, meaning the mesial view. Okay, the mandibular lateral incisor. Now remember, when viewed from the incisor aspect, the crown or the mandibular lateral incisor appears to be twisted on its root, and it angles lingually. It angles lingually as it progresses to the distal. All right, that's what we saw. And so when you come to the mesial view of the maxillary lateral, sorry, I keep saying maxillary, if you come to the mesial view of the mandibular lateral incisor, you can see where the green arrow is pointing. You can see that because of that twisting of the crown on its root, you can actually see. You're not supposed to see if it's straight. For example, if it was a mandibular lateral incisor in the proximal view, you wouldn't see the 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 incisor edge of the other side. Okay, but in the mesial view, the mandibular lateral incisor, you can see the distal marginal ridge peeking out on the lingual surface. Okay, and that is due to the surface angling lingually as it goes distally. Okay, try to say that fast. Angling lingually as it goes distally. That's tongue twisters. Okay. So, root concavities. So, mandibular lateral incisors, root concavities. When you look at the mandibular incisors and the canines, they frequently have root concavities on the mesial and distal surfaces. Now, remember, root concavities usually increase the surface area and they increase stability, attachment of the periodontal ligaments, and that's the stability of a tooth. Okay, the root concavities, as I just mentioned, they increase the surface area of the root and create areas that provide mechanical retention. That's the function of the root concavities. They are not just there to beautify, to make the tooth beautiful. They have function also. Okay. All right. So let's discuss about canines. All right. So canines. So in the facial view of canines, the crown of the permanent canine resembles that of premolars. In the facial view, the crowns of the canines, that is the permanent canines, resemble the crown of the permanent premolars in the facial view. Also, in the facial or lingual view, the crowns of the canines, they are pentagonal in shape. As you can see in the green outline there, that's a pentagon, five-sided polygon. Okay. All right. Now, cusp tips of canines. The cusp tip of canine. That's what we're talking about. Permanent maxillary canines. So we have discussed the primary teeth development. Later on, we're going to discuss the actual morphology of the primary teeth. Okay, but this lecture is about permanent teeth. Okay, so the cusp tip of the permanent canines are directly over the root center. Okay, as you can see, the lines drawn through the cusp tip goes all the way to the apex. Okay, those are very important points. And more of the crown. When you draw a line from the cusp tip to the apex of the root, you see that more of the crown is distal to the root center due to the prominence of the distal height of contour. So the distal height of contour of the canine, okay, is very rounded. Okay, so it shows it's kind of like like almost forming like a semicircle. Okay, so because of that prominent rounding of the distal surface of the maxillary canine, you see more of the distal portion, okay, when you try to divide the tooth in half. So let's talk about maxillary canines. So from the contact, so from the, so here the color corresponds to the box, okay. When you're reviewing on your own, just that's where it's corresponding to. So from the contact area of the to the cervical line of the maxillary canine, the distal surface of the crown is concave, as you can see in the picture, and the mesial ridge of the cusp is shorter than the distal ridge of the cusp. Do you see that? So the red line is very short compared to the orange line. Okay, very important key there. And there's always a reason for this. Okay, remember that when you're doing lateral excursions, you have to have some space for the cusp tips of the opposing teeth to pass through. Okay, and then the mesial surface of the crown is straighter, and the distal surface has a prominent convexity. So instead of saying rounding, another word is convexity. So when you go to take these exams, it doesn't mean necessarily that it doesn't necessarily mean that they're going to use the same words. They can use a synonym just to describe rounding, okay, or prominent. So make sure you know about the anatomy of the tooth itself. If you know the anatomy, then if they use a different word, it's not going to distract you from answering the question right or correctly. So this is a very important slide here. Okay, so make sure you review. All right. So the mesial height of contour of the maxillary canine. The mesial height of contour. The maxillary canine is located at the junction of the middle and incisor third. Okay. Now remember, the maxillary canine is contacting the distal surface. The mesial surface of maxillary canine is contacting with the distal surface of maxillary lateral incisor. And remember that the distal contact area of maxillary lateral incisor is located in the middle third. Okay. And now this becomes easy. Remember, for the lateral maxillary lateral incisor, the mesial height of contour is at the junction of incisor and middle third. Now look at this. When it comes to the canine, it's almost the same. The mesial height of contour is found at the junction of incisor and middle third. So it means that the distal height of contour is going to be in the middle third, right? So the contact areas for maxillary laterals and maxillary canine, they're almost the same. So you just have to memorize one, and you get the two questions correct for just memorizing one aspect of the tooth. Okay, so you don't have to memorize much for when it comes to maxillary lateral incisor, mesial and distal contact areas. So when you say where is the mesial height of contour of tooth number 7, you're going to say at the junction of incisor and middle third. Where is the mesial height of contour of tooth number 10? You're going to say at the junction of incisor and middle third. Where is the mesial height of contour of tooth number 6? It's going to be at the junction of incisor and middle third. Now, if they ask you where is the what for example, they say what do teeth number 6 and number 10 have in common? So that's a lateral maxillary lateral incisor and maxillary canine. What do they have in common? And the answer, one of the answer options says they both have the distal height of contour in the middle third. That is correct. Okay, so keep that in mind. So a very important slide. Make sure when you are reviewing this each tooth, make sure you put all the information together. Okay, they say, oh, I just reviewed this. Okay, now I can review this, and you have to connect the information, link the information. Okay, so it makes it easy for you. Now remember, the teeth, they don't work by themselves, they're working as a group. Okay, so you have to always put everything together. Okay, all right. The mesial and distal height of contours are at the contact areas. That is true for most of the teeth. Okay. Now, maxillary canine labial view. So you can see that it is wider mesial to distal than mandibular canine. Okay. What is the difference between mandibular and maxillary canine? Is that maxillary canines are wider mesial to distal. Now, remember that the tooth which is wider in the mesial distal aspect of all anterior teeth. So you have to listen to the question. When it says anterior teeth, it is going to be the maxillary central incisor. If they say, what is the widest tooth in the mouth? Of course, it's going to be the mesial distally. It's going to be the mandibular first molar. Okay, keep that in mind. So the mesial cusp ridge of the maxillary canine is shorter than the distal cusp ridge. We just reviewed that. And the distal height of contour protrudes because it is more prominent. The distal margin of the crown is shorter than the mesial margin of the crown. Okay. All right. Okay, so we have 10 slides to go for this review. So still on the maxillary canines. So this is the mesial view of maxillary canine. I like this image because sometimes I think like if you like fish, if you are vegan, and if any of you are vegan, I'm sorry, but if you like fish, or if you've seen fish before, this picture looks like a fish with an eye on it. Okay, so it makes it easy. Just remember, we learn best by association. if you associate something, a picture with another image that you know in your life, it makes it easier for your memory. Okay. So this tooth, maxillary canine, in the mesial view, looks like a fish. So in the mesial view, the maxillary canines. So the maxillary canines, they have the longest root in the mouth, and it is also said to be the longest tooth in the mouth. Now, it is not saying the longest crown. It is saying the longest root. The longest tooth, meaning the combination of the crown, the cranial crown, and the root. That taken together, they're long. Some of them are as long as 31. Some of them they go to 34. Okay, if you have 34 or 35 or 36 of a root from the maxillary canine, they're very difficult to do root canals because most of the files are short. Okay, so all these things have clinical significance. So maxillary canine, they have the longest roots in the mouth, and they have the longest tooth in the mouth. So they have the thick facial plate of bone, which is called canine eminence. Okay. And the canines are the last teeth in the mouth to be lost to periodontal disease. If somebody loses canines, you're like, what is going on? Let me investigate further. Okay, because usually you don't easily lose these teeth. They're the most stable teeth in the mouth, and they make excellent abutment. That's why when you see somebody can have extraction of all other teeth except they leave just the canines, because those make very good abutments for partial dentures. Okay. So due to the convexity of the cingulum, the lingual ridge. Okay, so you have in the maxillary canine, you have a prominent cingulum, and also there is a lingual ridge, and this makes the lingual surface biconvex. Okay, so two curved surfaces, biconvex. Okay. So still the mesial view of the canine. Now, very important here. Okay, very important slide. When you're viewing the maxillary canine from the mesial, a line bisecting the apex and the root, it is going to pass lingual to the cusp tip. Okay, as you can see in the image there. So the line from the root apex, it doesn't pass through the midline of the crown, it goes to the lingual side. Okay, it passes lingual to the cusp tip. So more of the maxillary canine. This is an incisor view. So in the incisor view, the crown of maxillary canine is the widest labiolingually of any anterior teeth. The widest tooth of any anterior teeth in the mesiodistal is the maxillary central incisor, and the widest tooth of the widest anterior tooth labiolingually is the maxillary canine, and this is due to the prominent labial ridge and the cingulum. And in the incisor view, the crown has a diamond-shaped outline. Remember, in the labial view, the crowns of the maxillary and mandibular canines, they are pentagons. Okay, in the incisor view, the crown of maxillary canine is a diamond shaped, and the middle labial lobe of the maxillary canine contains the cusp tip. So the cusp tip of the maxillary canine is found on the middle labial lobe. On the fascia, this middle labial lobe contains the incisor cervical crest of contour. Okay. Incisor cervical crest of contour. So the incisor cervical crest of contour on the maxillary canine is found on the labial lobe, middle labial lobe. Okay, so the incisor edge of the maxillary canine is more. Okay, you see in the incisor edge, when you look at the in the incisor view, you see more of the labial surface. Okay. However, you also appreciate more of the lingual surface. So the distal contact area is centered facial-lingually, and the distal contact area protrudes or sticks out. All right. So their maxillary canines are wider mesiodistally compared to the mandibular canines. They are more distinct lingual anatomy than mandibular canines. Okay. All right. So the plus signs here and the division signs and the crowd is to help you remember this tooth very well. Okay. Mandibular canine. So from the contact area to the cervical line, the mesial surface of the mandibular canine is straight. That is the yellow line. Okay. Now, the mesial surface of the crown is almost parallel to the long axis. The long axis is the black line of the tooth, and the two of the above statements are favorite board questions. The mesial ridge of the cusp and the mandibular canine is shorter than the distal ridge, and the distal cusp tip is offset to the mesial. Okay. All right, moving on. All right, so still on the mandibular canine, you can appreciate the mesial surface there in the green line, and you can appreciate the mesial height of contour and the distal height of contours designated by the arrows. And so the mesial height of contour of the mandibular canine is located at the incisor third, and this relates to the mesial surface being straighter from the contact area to the cervical line. And the distal height of contour is located at the junction of the middle and the incisor third. And the mesial and the distal height of contours are at the contact areas. Okay, just like any other teeth. So for the mandibular canine, they are narrower mesiodistally compared to the maxillary canines. They have, when you compare the mandibular canines to maxillary canines, mandibular canines have less distinct lingual anatomy, and the distal margin of the crown is shorter than the mesial margin. And the mandibular canine is the anterior tooth most likely to have bifurcated root, one labial and one lingual. Another favorite board question, okay? All right, so mandibular canine incisor view. So it is narrower, medial-distally compared. So most of the time, the mandibular canines are compared to maxillary canines. So in the incisor view, you see a lot of the labial surface. And for maxillary canine, in the incisor view, you see more of the lingual surface. Okay. There is indistinct lingual anatomy on the mandibular canine, and the distal contact area is centered facial-lingually. All right, so that's the end of this review. Make sure you review these lectures as numbered. Make sure you do review lecture 1, 2, and then you go to 3, because everything is going to make sense. Because as we go through, as you have seen, that we put all the information that we've learned in previous lectures together. All right, and we do have the next is going to be dental anatomy review number 4. And this is going to discuss more of the posterior teeth anatomy, okay? And then from there, we'll also discuss some of the primary teeth, okay? Root morphology for root canals, and then clinical considerations, okay? All right. If you have any questions, feel free to email at dentalboard@dboardexams.com. All right.